tinnitus always related to ear problem, or there are any hidden problems which is connected to brain?
Yeah, tinnitus to a significant degree is also connected with hearing loss, especially when the inner ear is being affected, where the cochlear regions are being affected. That's known as the cochlear loss or the sensory neural loss, where the nerve and the cochlea are being involved, because the hair cells get affected. The hair cells are not dead, but they become inefficient in their functioning. So they produce a certain sort of a sound, which is not a synchronous sound. Normally, when we hear a sound, it is a synchronous sound, like your piano. You have the reeds, and when you play the reeds, you hear a synchronous sound. But one of the reed is not functioning; it produces an abnormal sound. So sometimes the hair cells are malfunctional. Because of the malfunctional, they produce the harmonics of the frequencies, which are not the related synchronous. This goes to the auditory cortex, and the same representation of the cochlea is there in the auditory cortex. Thereby, the auditory cortex finds that this is an abnormal sounds and it gets exaggerated. So that is how it happens. And majority of the patients, as I told you, that the very high frequencies which you are not able to do the audiometric test also have the effect upon this one. Apart from this, most of the people, because of stress, develop and anxiety, they develop tinnitus. A greater population, if the anxiety and the stress is being controlled by behavior therapy, by counseling, by tinnitus retraining therapy, a lot of people get a lot of benefit. So it is also stress related, ear related, and also related to several other medical conditions, like oncology patient, because of certain chemotherapy, they start getting tinnitus much earlier than the hearing loss. So people who are on ototoxic drugs also develop tinnitus. So close monitoring is required, especially in endocrinology population in the middle age and in the higher ages. Tinnitus sets to begin, and it can be controlled basically if the proper medication is also being controlled and the patient seeks the medical health checkup at the earliest. So it is related to the ear, plus it is idiopathic, and it is also related to the psychological factors.
So, sir, what are the statistics of tinnitus, male and female ratio?
Yeah, the statistics is quite a large number. As per the estimates of the various studies done so far, 0.8 billion people suffer from tinnitus across the world. And where they have got about 4 million Google hits every year, people frantically searching for tinnitus therapy or cure or some amount of moderation. As the age increases, tinnitus patients are more, especially in the age range of 50 and above. But overall, the ratio shows that male have a higher incidence than the female as per the present statistics. So tinnitus is there in every population across the globe, whether it is United States or whether it is Japan or whether it is India. It is a uniform entity that is prevalent in the world.